A very good morning, madam. My name is Bahmani and I'm from Vancouver, Guru Parent, and I'm also from Cohort 15. So today my topic is going to be based on what is eczema. Okay, and the eczema that I chose was eczema among adults. Okay, so there are seven types of eczema among adults. So they are atopic dermatitis, contact dermatitis, dihydrotic eczema, hand eczema, neurodermatitis, Numeral Eczema, and also Stasic Dermatitis. So first of all, we're going to see what is atopic dermatitis is. Okay, actually, atopic dermatitis is a very common form of eczema. It usually starts in childhood, and also it will often gone when you goes away by adulthood. Okay, and also atopic dermatitis is a part. It's a part of what doctor called the atopic thread. Okay, thread means three, number three. Okay, so and also there are two diseases that you might get if you have atopic dermatitis. They are asthma and also high fever. Many people with atopic dermatitis have all these three conditions. Okay, what are the symptoms of in atopic dermatitis is? Okay, the symptoms are usually will get rash around your elbows and also knees. Okay, and then the skin area, so usually your elbow or your knees. If you have eczema on that area will be like turn lighter or darker or get thicker. Okay, and also the most important thing, we shouldn't scratch that place because it might get any infected. Okay, you will get infected, maybe it may be major. Okay, so be careful for it. Okay, what are the cause of this atopic dermatitis is? The cause is gene, dry skin, and it depends on your immune system problem, and also it's triggered in the environment as well. Okay, the next one we have is contact dermatitis. So what is contact dermatitis? If you have red irritated skin that caused by a reaction to substance you touch, you may have contact dermatitis. It comes in two types. So the two types is allergic contact dermatitis and also irritant contact dermatitis. So what is allergic contact dermatitis? It depends on the immune system reaction. Usually this allergic contact dermatitis is irritant to lactose and also metal. uh, and also irritant contact dermatitis starts is when you touch a chemical or other substance, so your skin will get irritated by it. Okay, the symptoms are your skin is itchy, turn red, burn, and also sting. And also like the over time the skin may be thickened and feel scaly or flattering. Okay, and the cause of it is because of bleed, jewelry, lactose, necklace, paint, solvent, tobacco smoke. So these are the causes of contact dermatitis. So the next one is Diacetic Eczema. Okay, this is my topic, so I later will clearly explain about it. Okay, the hand eczema. So hand eczema is a very common thing because hand eczema, so it affected only in hand. And also this hand eczema, mostly the people who mostly will get is for hairdressers, and also cleaners will get hand eczema because only hairdressers and cleaners are usually and regularly use chemical products that irritate the skin. So usually they will get this type, and also a healthcare people who works in the chemical department also may get hand eczema. So what are the symptoms? Your hand get red, itchy, and dry. They may form crack and also blister. Okay, the cause of this hand eczema is cleaning, hairdressing, and also healthcare department, laundry, and dry cleaning. So this hand eczema is usually to person the people who will get is who is usually working with the chemical department. Okay, the next one is neurodermatitis. So neurodermatitis is actually it's a similar to atopic dermatitis. It causes a thicker scar patch to pop up on your skin, and also the symptoms is thick scar patches form on your arm, legs, back of your neck, scalp, bottoms of your feet, backs of your hands, and also genitals. And also, if you scratch the patch, they may bleed and get infected as well. Not only neurodermatitis that you scratch will infected, all the eczema, all type of eczema, if you scratch it, you will get infected. So sometimes it may be like a major infection or minor infection. So just be careful if you get eczema, just be careful of it, okay? Okay, and the cause of it is just neurodermatitis usually starts in the people, who have other type of eczema or psoriasis. Okay, the neurodermatitis only will get for the people who starts with eczema or psoriasis. And sometimes even like doctor will be very confused because this neurodermatitis will also get if you triggered with stress. So just be careful to not get this type of eczema. It's kind of dangerous though. Even doctors are confused. Okay, the numeral eczema. So those type of eczema cause round kind of shape spotted to form on your skin. The word numeral means coin in Latin, and also numeral eczema looks very different from other type of eczema, and it can itchy a lot. So the symptoms of a neural eczema is round coin shaped spotted form on your skin. The spot may itchy and become scaly. And also the cause of it is neural eczema is usually it's triggered by a reaction by insect bite, and also allergic reaction to metal or chemicals. And also dry skin is also can cause neural eczema. And also you are more likely to get this form of eczema if you have other type of eczema, such as atopic dermatitis. So this neural eczema is usually will get if you have like other type of eczema lah. Okay. And also Stasic dermatitis. So Stasic dermatitis happen when fluid leaks out of weakened veins into your skin. This fluid causes swelling, redness, and itching and pain. The symptoms of it is you may develop open sores on your lower leg and on the top of your feet. The skin over those varicose veins will be dry and itchy. Your leg may acne or feel heavy. So this Stasic dermatitis for the person, okay, usually this one will get in leg, mostly in leg. Okay, so just be careful. Okay, let's see the cause of it. The Stasic dermatitis happen in people who have blood flow problems in their lower leg, usually in the feet. Okay, if the valve that normally push blood up through your leg towards your heart malfunction, blood can pool in your legs. Your legs can swollen up, and also varicose veins can form. So these are the reasons and the cause of like other type of eczema. So let's move on to my type of eczema. Okay, the type that I chose was Disatroc Eczema. Okay, even the name is fancy and scary. It scared me while I was reading the type of eczema. I got scared when I read this eczema because the name itself scared me. Disatroc Eczema. Okay, so the reason why I chose the Disatroc Eczema is, okay, this Disatroc Eczema mostly very common in women. So women can get Disatroc Eczema like easily. Okay, 90% of women can get. But how about men? Men are like very, very, very rare. It's not very common to men. If a 90% of women get Disatroc Eczema, 10% of men will get Disatroc Eczema. So women will get more and men will get less. So I just want to bring awareness among men and also women as well. Women have to be very women have to be very safe, and also men also have to be very safe because only like 10% of men will get Disatroc Eczema. So I just want to bring like awareness and also let them know. Just want to let them know to the men, like you guys also will get Disatroc Eczema, not only the women. Okay, so just but like very less, like just like 10% of men will get it. So 90% of women will get, 10% of men also will get. Oh no, like 90% of women will get, 10% of women don't get, 10% of men will get, 90% of men will never get Disatroc Eczema. I just want to bring awareness among them about Disatroc Eczema. So that's the reason why I chose it. And the second reason is the name is so fancy. I just like the name Disatroc Eczema. So and also scary. So that's the reason that I chose Disatroc Eczema. So let's move on to the introduction. So what is actually Disatroc Eczema is? So Disatroc Eczema is a characteristic by a rapid rash of tiny painful blister on the palms and side of the finger. Blister blister might form on the holes of your feet or your toes as a result of the skin disease. Okay, so what are the risk factor for Disatroc Eczema? Okay, the first one, family history. Family history. Okay, a family history of Diacetic eczema. So it's normally from gene. Okay. A next one is history, medical condition. Medical history includes so this medical history is depends on other type of eczema. So includes atopic dermatitis, contact dermatitis, and high fever. Okay. So if you have that, this Diacetic eczema, you can get easily. So usually doctor will go through your medical history first. Okay, and then increase in outdoor temperature during the spring or summer. Okay, so this outdoor means during summer means hot season lah. So if you this may get during like hot season as well. So it depends on the environmental as well. Okay, so you have to be very careful when you go out, if you have like very sensitive skin, if you go out without like you not putting any sunblock on your body, so you might get like Diacetic eczema, because they said that Diacetic eczema will get in a hot temperature, so usually in spring and summer. So just if you go out during summer or spring, just apply sunblock. So this may sunblock can protect your skin if you have sensitive skin. If you don't have sensitive skin, also just put some sunblock before you get out of the house. Okay. And also the last one is jobs or hobbies that involve having wet hands or feet for long period of time. So if you're a hairdresser or cleaner, or what else, some cleaner, hairdresser, or healthcare department who works in the chemical department with a wet hands, and but you guys will wear glove, but still your hand will be kind of bit wet. So you all have to be very careful. Just wear protection. So just wear like gloves, like how to say, a very good quality of glove, and be protected. Wear mask, wear socks to your leg, wear boots while you're working. Okay, so these all can protect lah. So these are the risk factor for Diacetic eczema. Okay, let's see the sign and symptoms of Diacetic eczema. Okay, so the sign and symptom is fluid filled with blister form on your finger, toe, palms, whole of your feet. Okay, and also this blister, the skin and scalp, the scalp, okay, and scalp are cracked and flagged. The skin, scalp, crack and flag, and also an itching or burning feeling around the blister, sweating around the blister. Okay, so these are the signs and symptoms of Diacetic eczema. So usually you'll get a blister lah, either in your hand or palms, or either in your finger, palm, or in the feet, the holes in your toes. Okay, between your toes. So these are the signs and symptoms. You will get a blister. Okay. So the next one is treatment for Diacetic eczema. So what are the treatment for it is actually, okay, the first one is taking antihistaminics to reduce itching. Okay, if you go to doctor or you go and consult a doctor, the doctor will recommend you to use antihistamine, because antihistamine can reduce the itching. Okay, it can reduce the itching, and also drain blister, and also it will drain the blister. Okay, so the next one is, if you go to a doctor, the doctor will recommend you antibiotic as well. So you'll get an antibiotic for the eczema. So you need to go to doctor, and the doctor will recommend you an antibiotic, and can increase the risk of harm to get an infection. So it will reduce the harm. It can reduce the risk of harm to get a major infection. Okay, and also the next one, you can take oral steroids such as prednisone, and to reduce inflammations. Okay, and also the next one is using light treatment, like exposure to UV lights. Okay, reduce the incidence of Diacetic eczema. So you need to go out in the morning. Using the light treatment is, you need to go in the early in the morning, around like 7, 7 when the sun rise. You need to go and get the sunlight into your body. So if you get that, that sunlight exposure will reduce the that will reduce the infection or the major infection of the Diacetic eczema. And the 5 one is applying over the counter corticosteroid cream to reduce skin inflammation and irritation. So steroid you can use in two ways. You can take it orally, or also you can take it by in the cream form to apply on it. Okay, so these are the treatment of Diacetic eczema. So the next one is guide on using products. So what are the guide on using products? Okay, first one, you can use antihistamine like diphenhydramine, benrite, or loratadine can help with the itching too. Or you might hold a cold wet compressor on the blister for 15 minutes at a time, several times a day. So you can take a wet towel and you can put it in the refrigerator and take it out. You know, a wet towel, you put into the refrigerator and you take it out, and you can put on top the blister for around like a 15 minutes, and also several times a day. Okay, so just like 5 times a day lah for 15 minutes. Okay, and the second one is the medicine that slower your immune system is tracolims. Higher up medicine that higher up your immune system is tracholimins. So ointment, or you can take pimercolzine cream, can calm the swelling and also irritation. So you can use these two creams to calm the swelling and also irritation. And the last one is hand Diacetic eczema is several of flares happen. Often dermatologists may prescribe light therapy, topical clinotic inhibitor, or oral steroid. So if you go to a dermatologist, they will recommend you three type of treatment. So they are light therapy and also topical clinotic inhibitors and or oral steroid. So these are the 3 things that a dermatologist will recommend you. Okay, so the last one is counseling for patients. Okay, counseling for patients. Okay, people with eczema often struggle with a poor self-image and low esteem, especially teenagers. So teenagers are very concerned about their skin. You know, like even they get a little bit scratch, also they were like, oh my god, what is this scratch on? I need to clear it up. So usually the teenagers will have like poor self-image and also low esteem. So in several cases, the appearance of their skin can invite teasing, and especially with children, adult, teenager, individual with per relationship. Okay, the sleep disturbing that may accompany atopic dermatitis put added stress on individual and those closest to them. So usually they will never get a good sleep, and also they added stress, you know, on other people, like for parents, for example, like parents, sibling, the person are very closest with them. Okay, how do doctors, or how do doctors counsel for the patient? So for example, eczema patient who are experiencing a lot of stress may benefit from psychological counseling, or even from taking anti-anxiety drugs. Relaxations therapy and also biofeedback also can be helpful for people who are finding it hard to control their scratching. So usually eczema people, right, people who get eczema, they shouldn't scratch their hand or their leg or their feet, because if they scratch, it may cause a major infection. Okay, so so the doctors usually says that the people cannot be scratched. Okay, the people shouldn't scratch their hands, scratch their legs, okay, because sometimes it will be bleeding, you may get any bacteria infection because of that, from eczema change to bacteria infection. So it's kind of very major thing, right? So usually the doctors or the counselors will recommend them to go for a relaxation therapy and biofeedback. Okay, because it can helpful for them to control their scratching. So these are the very common counseling that we can give for the patients. So that's all from me for today. So hopefully I had I had given all the informations. So thanks a lot, madam. Stay home, stay safe. Bye.